down the behavior of the drug to just deal with pain. And whereas in natural medicine, which is available in nature in its untouched form, there are a lot of chemicals in the product, and so it will give you different effects. It will work on the pain areas, but it might also work in other areas. It might have antiviral properties. Um, so therefore, it might be a bit more different. But in science, they want to ensure that they can predict how the drug will work for the individual. So that's basically the difference.
Okay, so you mentioned the word effects. Now, can you tell us some more about adverse effects or side effects? What is meant by that term, or those terms?
An adverse reaction is an effect of the drug that is not wanted and may be harmful. Now, everyone's reaction to a drug is different because of how the body handles it. We talk about the genes and how we process things. Then when you have a side effect, now these side effects are unintended or unwanted effects that the medicine may cause. And sometimes people take medicines without having side effects, but some people do have them. So I would say adverse drug reactions are more serious, whereas side effects are not necessarily as serious. And in fact, sometimes the side effects, given a simple example, a drug may be given to someone to help their sinuses to be less active. For example, we call it antihistamine, like DPH, diphenhydramine. But a side effect will be drowsiness. Sometimes the side effects of the drowsiness can be used in a different condition, like for insomnia. If you're not sleeping well, sometimes if you're just having a mild effect of insomnia, then an antihistamine that causes drowsiness might be helpful. And so sometimes when you have side effects of drugs, they can be used in what they call off-label uses to treat other conditions. And then you have clinical studies now that are run to ensure that these off-label uses do not pose harm to the individual.
Okay, so just to clarify something about a side effect, I think some people believe that when you talk about side effects of medications, they think it's something that must happen. So these are the side effects. When I take the drug, this is what's going to happen. Is that the case?
Not necessarily, because again, using the example of DPH, some persons might have the side effect of drowsiness, depending on the dose at which you use it, whereas another person doesn't have that side effect because you have this thing called metabolism, how the body breaks down the drug and uses it up. Somebody's metabolism, or the way they use the drug, how the thyroid acts in the body and other organs may act quicker, so the drug gets used up quickly and they might not have that drowsiness effect. Whereas another person, their metabolic rate, the way all the drug is used up in the body, is quicker, and so it wouldn't affect them. Whereas another person who's slower might have the effect. So it really depends on how the person uses the drug in the system. And some side effects may be due to your immune system. You may be allergic to the drug and therefore you end up with a rash. Whereas another person doesn't have that effect and may not get the rash. So some side effects may not be evident in one population compared to another person.
Okay, all right. Thank you so much. And for those who are joining us a little late, this is Ask the Expert. We're discussing medications and side effects. We have Dr. Winsome Christie here with us, who is a naturopathic physician and also a pharmacist. Okay, all right. So next question. So this question came in saying, I'm on steroids. What are the side effects, especially for long-term use?
Well, long-term use of steroids, because steroids are actually manufactured in the body, and we have cycles in the body. when you take steroids for a long time, they can interfere with how the body's cycles work. For example, sleep and wake cycle. The cortisol, there's trying not to use too many big terms, but the cortisol,
Yes.
persons know that as the stress hormone. So if you have high cortisol levels in the body, then you can end up with insomnia, lack of sleep. So if you take steroids for a long time, and depending on which body system is affected negatively, then you might end up with insomnia as a side effect. If it affects your adrenal glands, then you can end up with what they call Cushing syndrome, where the adrenals produce too much of a certain type of hormone, and then you put on weight, you get weight gain. Then your face might become round. They call it moon face. So
Right.
right, so those type of side effects might occur because the steroids are actually interacting with your hormone system. Not that they're the only one. There are other drugs that do it too, and science is just realizing that that's what's happening.
Right. And steroids can also predispose you to diabetes, high blood pressure. It can cause issues with the vision, and easy bruising to the skin. So there can be quite a few side effects of steroids, depending on the length of time, and also on depending on the dosage of the drug.
Correct.
So you may have touched on this before, but this question is, why do we get side effects from the medicine that we take for our sickness when in fact it's supposed to help us?
Excuse me, let me just plug my computer and it's gonna die.
Sure, sure.
Again, it depends on what is happening. So if, for example, your immune system is overactive and you take the drug and you develop an allergic reaction, depending on how severe the reaction is, it can affect your breathing, you can have shortness of breath, you can have skin reactions. That would be allergy. That's unintended. No one can predict that because you can even eat foods and get allergies, and no one
Right.
can affect that. Also, if you, for example, some drugs might cause your stomach to be more sensitive to the acid, and because it reduces the amount of mucus being produced, and so you end up with a stomach irritation. Some people are more predisposed to have stomach issues, and so they might say, oh, when I take that pill, my stomach burns me 2 hours after. I'm getting chest pains, which is more related to like digestive issues. So that can happen. Um, some can cause constipation. If you already have the tendency to develop constipation, if a drug has that issue, then you will tend to have it more than another person. So it really depends on what is happening and how you process the drug, because everyone's different. And in medicine, we call it idiosyncratic reactions. You have reactions that is just unique to this person. And so it might be 1% of the population. So it's really because of the individual nature of persons why we have different reactions to drugs, and then you have side effects because those are not what the physician or the manufacturer intended to happen to you, but it happens.
It can happen. Okay. Now this question, I think what they're intending to ask is, if you have an illness in your body, how do you know whether it's the medicine or if it is the primary condition? I'll try to tackle this one. Now, generally, your physician will have knowledge of some of the symptoms of whatever condition it is that you have. Your physician should also know the side effects or potential side effects of your medicines, which is what we're trying to educate you on today as well. So knowing what your disease can do and knowing what the medication can do will help to differentiate based on what is happening in your body, whether it is due to the medication or due to your illness. Okay. Okay. Next question to our naturopathic physician. Why can't they find natural things to give patients for their illnesses?
Okay. As I mentioned before, the products that's available in nature are very mild in how they act. And what you find is naturopathic physicians or herbalists will tend to have to give more than one modality. They have to give more than one herb. They have to use different modalities, like sometimes stress reduction techniques, exercises, massage, all different modalities to help the person deal with the condition. Now, in medicine, um, they have potentiated the effects of drugs to help the person get through quicker because it does reduce the cost of treatment if you and the time you take with a patient. So not all, and also the way how medicine has developed and evolved, there's now differentiation. So the scientific approach involves more potent medicines, and they need to develop research to prove that the traditional herbs that's being used are safe and effective for the patient. So that is why you now have terms like integrative medicine, because medical doctors and other professionals are conducting clinical trials, research to establish that these traditional therapies that we've used to coming up throughout the ages are in fact safe, and they're trying to establish the correct dose at which it can be used to relieve symptoms. If I might answer one of those questions about turmeric that's being used for lupus. Turmeric, they're doing a lot of studies now. It's a great herb. It's fantastic because it has a lot of anti-inflammatory properties. And for
Right.
lupus conditions, there's a lot of inflammation going on. And so that herb, they have found from the studies that it's very good. Now, the dose at which you have to use that herb for its anti-inflammatory effect would be like 2,000, in fact, was 3 to 4 grams of the root twice a day for 2 to 3 months. I think that's sometimes why what people don't realize. You can't just take a herb for like 1 week or 2 days and then say, oh, it's not working. It has to be in a systematic manner, just as how you would be taking your methotrexate and the other medicine that the doctors recommend. So at 3 to 4 grams of the root, that will be taken twice a day for 2 to 3 months. If you are using the powder, it's 1 teaspoon twice a day for 2 to 3 months. If you're using the powder again for the skin itching, it's given a bit more frequently, a teaspoon 3 times daily for 2 to 3 months. So studies now are the ones that have established it. And again, turmeric, sometimes certain doctor can attest to that. Lupus patients might complain of having sleepless nights, insomnia. They are discovering that turmeric can be used for insomnia and
Oh,
also for,
really?
yes, for depression
Okay.
and insomnia. So I thought that was very interesting,
That
and
is news to me.
yes, it can be used now in depression. Psychologists abroad, integrated psychologists are using um, turmeric for depression.
Yeah, I see.
And also for the inflammation, for inflammatory conditions. But then, as I mentioned, those are the doses.
Okay, super. So, so on this same vein, what would you say then to a lupus patient who says, I'm going to stick to natural treatments from herbal doctors only?
Well, that doctor would have to be properly trained, and I don't know if we have that right now. That person can do. It's a partnership. It's a teamwork. So I think there should be collaboration, and the rheumatologist like yourself and other specialists should be monitoring the patient with their blood work to look at the
Right.
inflammatory markers to determine whether the treatment is working. It's not really about taking just because it's herbal. You have to look at the symptoms that the person is having, the swellings, the rashes, all of these indicate the physical symptoms. And then the doctors would have to then look at the blood work to monitor to see how they're going. Are they going down? And if it's skyrocketing, which can damage the kidney and other organs, then you would have to say it's not working and do something else, because medical doctors and naturopaths alike must do no harm. Everyone subscribes to Hippocratic oath. So it has to be done properly. So I believe it's more collaborative effort where the rheumatologist will be monitoring the patient with the blood work, because I don't think in Jamaica at the moment naturopaths may be allowed to be doing that because there's no license for them at the moment and a structured way in which they practice. I personally practice based on my clinical pharmacy license, and I encourage the clients to check with their doctor to monitor the specific blood work that would indicate that the therapy is indeed working. Of course, the person will feel better too, you know, the joint pains and the swellings and the inflammation.
Right.
But the doctors still have to monitor to ensure organ damage is not being done, you know.
And I think that's such an important point to bring across to our patients, that it's teamwork.
Yes.
And it really is, like you said, a collaborative effort, not necessarily one or the other, but working together for the best outcome for our patients. Okay. Dr. Christie, what are some of the side effects of methotrexate, which is a common drug that we use in lupus?
You know, I did make a note of it. Let me see if I get back to my notes here. There were so many questions that were asked. But basically, methotrexate, this is really an unseen side effect, but it does decrease the amount of folic acid that a person has in the body. And so they could cause folic acid deficiency. It can cause upset stomach, which is a general, you know, it can cause skin reaction, general side effects. There are some other serious ones that I came across. I think persistent use in long term can cause cancers, some form of cancers. But from my experience, I'm not seeing persons who are on methotrexate developing any form of cancer in our population. Because sometimes these things
are uncommon.
Yeah, that's right. So the methotrexate, the person I see on methotrexate, I don't see them exhibiting any major side effects. The things with the literature is it's speculation sometimes. It doesn't have to happen in clinical. So that's the thing. That's sometimes why I don't go through the list of side effects with patients, because it's all speculation. It doesn't have to happen. So I don't turn people off their medicine. So I don't tell them too many long drawn out lists, because there's more benefits for the person to take the medication than to focus on the side effects. And the mind is very powerful. If you keep focusing on things, you might just well start to experience it. So I tend not to focus on it. I tell them to take the medication. And then if they have any issues, I tell them to take the food. We go off the recommendation of the rheumatologist like yourself, who recommended divided doses of the drug. And we tell them to take it with meals. And basically, I don't see a lot of side effects with methotrexate, to be honest.
Right. So, you know, methotrexate is a medication that we do find to be safe. We use it a lot, but it does need to be monitored. So we do have to monitor your blood count. We do have to monitor your liver function, your kidney function. There are instances where there can be abnormalities in the liver test and in the blood count, okay? So monitoring is what's important. Like Dr. Christie said, these are not common, but they can happen. So what is imperative is that you follow up regularly with your physician. You develop a relationship so that we can communicate and discuss what is happening and what you are experiencing. Dr. Christie made a point about methotrexate depleting the levels of folate, which is why you do need to take folic acid. There was another question about why it is that you need to take folic acid, and that's because methotrexate depletes the level of folate. And in fact, folate actually mitigates some of the side effects of methotrexate, like nausea. Some people get hair loss. Some people get ulcers in the mouth. And sometimes with the correct dosing of the folic acid, you find that those side effects are significantly reduced.
If I might add to Dr.
Sure.
That's why sometimes some drugs cause side effects because they are depleting essential nutrients. You have what is called drug nutrient depletion. For example, metformin, which is a diabetic medication, depletes magnesium and B12. And sometimes the leg pains and all these things that people are having as a side effect of the drug will be corrected once these minerals are, restored. So sometimes that's another reason why people have side effects. So the doctors are now realizing that they need to give supplements while the patients are on certain medication.
Next question. Celcept is a teratogen. How is it safe for people with kidney issues due to lupus? Now, for those who don't know, a teratogen is an agent that can cause malformation in an embryo or a fetus. Now, generally in pregnancy, there are many medications that have to be avoided. Whether you're a lupus patient or not, there is a lot of caution with medications that are safe in pregnancy. And some of the medications that we use to treat lupus are no different. Now, for kidney disease in lupus, there are medications that we can use that are safe for the pregnant patient. Celcept is one of them. So again, this is going to be a discussion with your rheumatologist and your obstetrician. If you have kidney disease and you are pregnant, then we adjust the therapy to another agent that is safe for the developing fetus. Okay? So I hope that answers that question. Anything to add there, Dr. Christie?
Yes, I did see where there were there's a clinical trial in progress, and I didn't see any other studies to show that drug being used by itself for kidney issues in lupus patients. However, it was used along with other agents like tacrolimus and other steroids. But then that's now going to examine if it could be used. So the answer to that question would be it can be used, because if it can be used with other agents in patients with nephritis, then it can be used by itself. But I guess they wanted to ensure that there was more efficacy of the therapy while they combined it with others. So they're doing clinical trials now to see if it can be used by itself for patients with kidney issues, lupus.
Okay. All right, so we are running out of time. A few more questions we're going to try to get in very quickly. Do you know of any natural remedies that can be used in patients who have lupus and kidney disease?
Okay, well, I do know nettle, that drug, well, the herb, I'm sorry, but I guess there's a blurred line between a herb and a drug when it starts to work efficaciously. That herb has a reputation of helping to restore kidney function if a person is even on a dialysis machine. It helps them to reduce the amount of sessions they need. So, yeah, nettle is one. You have other herbs that's good for the kidney, like Uber parsley and dandelion. Those can help kidney function to return to normal or to be improved for persons
Okay.
with dementia.
Okay. Uh, this person says, I take low dose aspirin prescribed by my cardiologist. I read somewhere that aspirin must not be taken with methotrexate. Is that true?
Well, let me just quickly do a drug interaction here and see what happens. Analyze. That's quite true. It's not recommended. And they're saying salicylates like aspirin tend to increase the blood concentration of methotrexate. So the recommendation is to consider modifying the therapy. So possibly to use something else. Let me see if clopidogrel would be a better substitute here. Um,
Well, what we do sometimes is a lot of patients are on methotrexate and aspirin or methotrexate and other NSAIDs, but in terms of it increasing the blood level of the drug, that's why we monitor. So
okay.
we do monitoring, and if necessary to do a dose adjustment, then we do a dose adjustment. But there are patients who do need their aspirin, and they take their aspirin, and they also need their methotrexate, right?
Okay, I just did the interaction with clopidogrel, which is also a blood thinner like the aspirin, and there's no interactions found. So
Right.
possibly you could try that one. But then as you mentioned, in clinical practice, you don't see that speculation of elevated blood levels. And then if you did see because of your monitoring, you would adjust the dose.
Right.
So just clopidogrel has no interaction.
Okay. Thank you, Dr. Christie. So that's what I would say to that patient, to discuss it with your physician. So I wouldn't, on my own, decide I'm going to stop the aspirin because that may be very important if you have heart disease. And that really is based on just monitoring and can be addressed by dose adjustments. Okay. Can prolonged use of hydroxychloroquine cause heartbeat irregularities?
Yes, because the studies show that it affects the T interval. And so it does affect the heart. And that's one of the reasons why it was not being used for treatment of COVID, because the studies that were coming out would show the negative effect it was having for the heart. And remember, the COVID disease does affect the heart and all the internal organs, heart and lungs and others. So that was one of the reasons why it was not recommended, because the studies were showing it was having negative effects, too much negative effects.
Right. So, but again, this hydroxychloroquine, it can cause heartbeat irregularities, but in clinical practice, we use hydroxychloroquine so much that's really not something that we see commonly
In our population.
in our population. So just to differentiate with what is possible and what is probable, okay, with some of these medications that we use. And
If I might add to Dr.
sure, yes,
the clinical data for our population, which is important
right.
for our doctors and our clinicians, they don't see it happening. And people are on this drug all the time and they've been monitoring and it doesn't happen. I've never really heard anyone who's on hydroxychloroquine twice a day, 200 milligram BD for months and months and months because of the rheumatoid arthritis or whatever it is that they're having. They've never really had those issues. And as you said, they're being monitored. So it's what, as you said, might happen and what actually happens. And we don't have it in our population on such a wide scale.
Right, yes. Yes, and just remember that in lupus patients, it is very good increasing the overall survival, this medication, hydroxychloroquine. Okay, there are many more questions, but we are not going to get through them all because we are over our time. So we may have to invite Dr. Christie to do a part 2, but we're going to have to wrap up here. So I apologize for the questions that have been left unanswered. We will try to address them at a later date. Dr. Christie, thank you so very much.
Thank you very much for inviting me. I enjoyed it. And hello to all you viewers who asked me all these lovely questions. And I hope we answered them enough for you.
Okay, take care. Goodbye, everyone. See you in our next session of Ask the Expert.
Okay, bye.